And so it lets you kind of take a lot of the boundaries away as far as place of care, right? So first of all, how it comes to care delivery, when you're not getting paid based on RVUs or insurance billing, you can do what makes sense, right? And so if a patient calls you who's 45, she's like, look, I have a yeast infection. I've had 8 of them. I know it's not that. I know it's not anything else. If you know that patient, you have an established relationship, and she tells you that, okay, just send her a treatment, but you don't have to bring them in for every little visit to collect a copay. And so it lets you kind of take a lot of the boundaries away as far as place of care, right? And so you just say, hey, just text me if it doesn't go away, or you can book yourself an appointment right on my schedule if you need help or if something changes. So first of all, like the way you deliver care, really becomes boundless. I would say the second thing is that because my appointments routinely are 45 minutes long, they can be longer if you need it. We can talk about things that are often related, but sometimes dismissed due to time in the hospital-based clinic. So great example, like GI upset and thyroid dysfunction, or depression with thyroid dysfunction, metabolism and thyroid dysfunction. I mean, all of those things, which are obviously connected because we're all it's all part of the same body. You can actually take the pieces, put them together, and problem solve from a holistic view instead of dealing with one problem at a time. And I see that a ton. I'm sort of known as the first doctor to ever listen. That's sort of my reputation. And of course, that's flattering, but really it makes me sad. Like, I don't know what you heard in med school, but I always learned if you listen long enough, the patient's going to tell you what's wrong with them, right? But then how can you do that in 5 minutes? And so
No,
it
you
doesn't
can't.
make any sense. And so what it's let me do since opening my own practice is to take these previously fragmented concerns and sort of piece them together and treat it or counsel the patient on a way that makes sense instead of them being on 10 different medicines from 10 different doctors. And so it's really rewarding, and the patients are like, wait, you're going to take me off of these 3 medicines? Thank God. It's a really rewarding experience when you have the actual time to put all the pieces together and tie it together and educate the patient on it too.